Hi everyone, this is Dr. Merhaut from Elite Sports and Spine Chiropractic. Continuing with the Elite Education series today, we're going to be doing a squat analysis. I have Dr. Keklak here today with me. He's going to be demonstrating some of the squats as I analyze some of the movements, and we're going to be going through a little bit with poor form and how to correct the poor form, things to look for when you're doing your own squats, whether it's with or without weight, and ways to prevent injuries associated with that. So to start things off, we're gonna call this a functional assessment, where we're gonna have them actually go through the squat motion, and we're gonna look at different angles from the front, from the side, and from the back to see if we can notice anything that's a little bit off. Things in the knees, things in the ankles, things in the hips. We'll go through a couple of those things, the most common ones that we usually see on patients or on athletes when we do these functional assessments on them. So first I'm going to have Dr. Keklak start with just shoulder width apart with his feet. We're going to just cross the arms over the chest just for purposes of doing a normal squat. And we're going to have him go into a regular squat. Just it doesn't have to be that low, but just go ahead and go into the descent of the squat and then go back down. So things that we're looking for right now, let's focus just on the knees. His knees are good. They should be somewhat in line with the toes. They shouldn't be caving in. That's called valgus stress if the knees cave in, and they shouldn't be going outward a whole lot. That's called varus stress of the knees. So valgus stress of the knee puts a lot of strain on the inside of the knee, whereas varus stress when you're going out puts a lot of strain on the outside of the knee. So if you have knee pain when you're doing a squat, then this is something to look for if your knees are caving in or if they're going out during your squat. So I'm going to have Dr. Keklak demonstrate what valgus stress looks like when you're going into a squat. Have him do it a couple of times just so you can see what that looks like. So go ahead and demonstrate that with the knees caving in. Good. And if you demonstrate it just a little bit more exaggerated, almost like they're going to touch a little bit. So that's sometimes what we'll see, both knees caving in. If you have medial knee pain on the inside, that's often one of the problems with the squat is the knees are caving in. So a simple way to correct that is you can put a band around the knees so that the band is pushing the knees inward, so that forces you to push the knees out as you go into the squat. So that's one thing we'll look for is valgus stress or medial stress on the knees as you go through the descent of the squat. Another thing that we'll look for when we're looking at the front of the squat is there a weight shift from right to left? So that's something that we can commonly see that would be due to a weakness, usually on the lateral musculature of the hips. So I'm going to have Dr. Keklak demonstrate this one. We'll have him shift over to the right as he goes down into the squat. And you can see that puts abnormal stress on the hip, it puts abnormal stress on the knee, as well as down through the ankles. So that's another thing we look for when someone's going through a squat. Now we're going to have him turn and face the opposite direction to the side. So we're going to look at the squat from the side position. With this also, we'll focus in on the knees first. With the knees, you don't want them to go too far over the toes. That puts a lot of stress on the front of the knee. So if you have pain in the front of the knee, popping, clicking in the front of the knee when you're going through your squat, this could be one of the causes you're putting too much weight forward during this motion. So I'll have Dr. Keklak demonstrate that with too much forward motion with the knees. Go ahead and go a little bit further just to exaggerate it. There you go. You can even see a little bit his heels come up off the ground. It might be a little bit hard to see that, but when the knees are coming forward, the heels are coming off the ground. That could be due to a little bit of tightness in the posterior chain, so the hamstrings, the calves, those muscles could be a little bit tense. Another thing that we look for on the side is ankle dorsiflexion. So when the toes are coming forward, that's called ankle dorsiflexion. So when you're going down into your squat, if you don't have proper ankle dorsiflexion, then sometimes we see that the ankles will rise up off the ground. That could be due to tightness in the calves, tightness in the hamstrings. It could be due to joint fixation within the mortise joint, which is one of the joints within the ankle. So that can be corrected through adjusting techniques, through soft tissue mobilization, muscle releases, and stretching through those areas. Another thing that we'll look for on the side with the squat is the angles of the tibia, so the leg right down through here, as well as the angle of the back in general. So those should be somewhat parallel with each other in the squat. You don't want one being up and one being down in different directions. So you're looking to see somewhat of a parallel relationship between the tibia and with the low back. So we'll have him go down to the squat. Just hold it down for a second. And you can see his is pretty good. He's got a nice line right through here as well as a line through here. Those two areas are somewhat parallel to each other. So that's one thing that we also look for with squat form. One other thing that we look for from the side view is that he's hip hinging properly, so that the butt is going back first before the knees start to come forward, and then also that the back isn't too rounded inward or rounded outward. So with that, I'll have you just watch again just how his back looks when he's going down, how his butt goes back first. We'll have him go down to that descent. And he doesn't round the back out at all. There's not too much hyperlordosis, which is the abnormal extra curvature through the lumbar spine. Those are different things that we look for from the side. And then I guess I'll go one more thing into detail with the side, is that you can notice the weight shift. So if the weight shift is going back on the way up, that could indicate a little bit of weakness through the quads. So I'll have him demonstrate that a little bit. So he's going to go down into the squat, and then as he starts to come back up, he's going to shift his weight backward. And that's real subtle, but you can see that there's a little bit of weight shift. So all these motions that we look at from the front, from the side, most of them are subtle movements that we're seeing, whether it's the knees, the ankles, the hips, the weight shift from one side to another. So it's always beneficial to have someone look at that kind of thing to see if you're doing something with your squat that could be either causing pain in general or predisposing you to some type of injury. So those are general things that we look for in a squat here in the office, and also when we're assessing athletes and just everyday people that come through the office. So if you think someone can benefit from this video, feel free to share it with them. If you feel like you need someone to look at your squat form, you're more than welcome to stop into the office and make an appointment. This is the Elite Education Series. Dr. Merhaut here with Dr. Keklak, Elite Sports and Spine Chiropractic. I hope you join us next week as well.